Have you ever heard of a pelvic organ prolapse or a prolapsed bladder? Well, if you're looking up your symptoms online, you're experiencing some things that are not quite normal for you, or you're feeling discomfort down there, then stop Googling your symptoms. Keep listening to this video where I'm going to talk about what the symptoms of a prolapsed bladder actually are and what you can do to ease it without having surgery. So did you know that almost 50% of women ages 50 to 79 have some sort of prolapse? And we're talking about the pelvic organs here, your bladder, your uterus, your rectum, even the vaginal walls. And a prolapse is something that's more common than women actually think. And even if you're not having symptoms, this actually could be something that you have. So my goal is to guide you in the right direction, and just the more you know about your body as you're aging, then the better. And you can do something with it that may not require surgery. So as a pelvic floor physical therapist, my name is Dr. Dawn Andalone. I help women all the time who want to ease their symptoms, live a more active and happy life, and want to do it more in the holistic or conservative route. So as a pelvic floor physical therapist, I help women with the area around their pelvis, their back, their core muscles, and how they all work together to really support your pelvic organs. If I show you on a pelvic model here, here's your hips. So you have your hip socket here where your femur, your thigh bone goes in. You can see in the back, here's your spine and your tailbone. And so on this pelvis here in red, that is what's called your pelvic floor muscles. You have 3 layers to your pelvic floor. So those muscles are very important for supporting your pelvic organs, helping with bowel and bladder function and sexual function as well. So these muscles, and maybe you've heard of Kegel exercises and doing strengthening exercises for these muscles. Well, I'm here to tell you that not everyone needs Kegel exercises, but we're going to go back to what actually is happening with the prolapsed bladder, what symptoms you might be dealing with. So a prolapse can be described as when one or more of those pelvic organs are actually dropping from their normal position. They're held together by ligaments at the top. So when they drop from their normal position, they may protrude down into the vaginal area. And in this case, we're discussing a prolapsed bladder. So one symptom that I hear a lot from my clients is they might be experiencing more frequency, more urgency to get to the bathroom on time. So not only do those bladder symptoms come with a pelvic organ prolapse, you may just have a change in the pelvic floor muscles and don't necessarily have a prolapse if you're getting that frequency and urgency or leaking. But it is common with a prolapse that those bladder symptoms will exist. The second common symptom that I hear a lot of the clients that I see, they say they get this uncomfortable feeling down in their lower belly, around their stomach there, that they're getting this achiness, this pressure, almost like a discomfort that they get in that lower abdominal area. Now, this may exist with standing for long periods of time, doing a long walk, or even at the end of the day, especially if they've been upright a lot during the day. Now, the third symptom I hear a lot of the clients that I see say that they actually feel or see a bulge through the vaginal area. And this is the one that tends to scare a lot of women. So don't be scared if you're feeling this or seeing this. It doesn't always mean that you need surgery, but some women say they actually physically feel like a golf ball size feeling or a bulge into that vaginal opening, or even protrude out at different times of the day. Now, I've heard women say that they feel like they have a tampon that's falling out, or they see this golf ball size bulge there in the vaginal area. Now, prolapse can come in different stages as well. You may have a stage 1, stage 2, that's a very minor prolapse. It may not come with any symptoms. You may not even know that you have it, but women can exist with some of these symptoms and be a very mild stage 1, stage 2 prolapse. Stage 3 or stage 4 is going to be a little more severe, where you may physically see that bulge come through the vaginal area, or you're feeling some of those symptoms I was describing as the third most common symptom. Now, if you have been diagnosed with a true prolapse by your doctor, or even seen someone like myself, a pelvic floor physical therapist, that told you you might have a prolapse, well, don't be worried, don't be scared. There are women that I have helped from a stage 1 to prolapse up to a stage 4 that were ready for surgery, but wanted to try something else to see if their symptoms could be eased and solve their symptoms. And sure enough, with the right guidance, you can get help and not have to necessarily go down the route of getting surgery. So like I mentioned, almost 50% of women between the ages of 50 and 79 do have some sort of prolapse. And because this is so common, not a lot of women will talk about it. But that's why I like to do these videos. I want to share that it's actually more common than you think. And it's good to know these things before you end up having these symptoms, or even if you do have the symptoms, what you can do now to help ease them and help make yourself feel better and more confident about your recovery. So some of the things that can lead to a prolapse, just because women want to know what could have caused this. Well, a lot of factors can come into play here. Sometimes being overweight, gaining a lot of weight where you're getting a lot of pressure down in that pelvic area, and therefore can put pressure on your pelvic organs. That can cause it. Sometimes after childbirth, after labor and delivery, when women are doing too much, lifting heavy items, and they are still trying to heal afterward, sometimes that can cause a prolapse as well. If you have a lot of chronic constipation, you've been dealing with this for many years, so you've been bearing down and pushing a lot when you go to the bathroom, sometimes that can be a cause of prolapse. So anything that's really going to put a lot of pressure down in that area, or holding your breath and really bearing down and pushing, that can set women up for a possible prolapse in the future. Now, not to scare you, some women, this is actually more of a hereditary thing, where their connective tissue, depending on their genetic makeup, can actually lead to that connective tissue lengthening and stretching. Because those pelvic organs are held up by ligaments, those ligaments soften and lengthen and weaken, and therefore can have that bladder drop down from its normal position like I discussed. So what do you need to do if you think you have a prolapse and you're experiencing any of those top 3 symptoms that I mentioned earlier? Well, number 1 is seeing a pelvic floor physical therapist. You don't actually have to consult with your doctor to say you need to talk about surgery. If you did go to your doctor and they mentioned that you have a prolapse and they recommend surgery, please consult with a pelvic floor physical therapist first. This can be a game changer when it comes to what those muscles can do. And if you solve the root of the problem and go to someone that's going to work on pelvic floor, either strengthening or relaxing the muscles, whatever they need, it's not always Kegels, but doing some core exercises that are going to teach you how to redistribute that pressure, so you're not actually putting all that pressure down on the pelvic area. When you lift items, or when you're standing or walking or exercising, it can be a game changer. So because we're trained in movement and the musculoskeletal system and how to get the most benefit out of it, then it really is so supportive for those pelvic organs and can make a huge difference. So if you do consult with your doctor and surgery is discussed, well, please go see a pelvic floor physical therapist first. I've got lots of info below, which a downloadable guide on tips that you can use to solve and ease your symptoms of a prolapse. So go over and download that guide. It's truly helpful for so many women that I have worked with. And if you are wanting to learn more about prolapse and exercises that you can do to ease your symptoms and even ways to ease your symptoms. I have other videos on this channel all about prolapse. So in this video today, because we talked about a prolapsed bladder and having any of those top 3 symptoms, tell me which one you learned, what was new to you. I'd love for you to comment below, like the video, and hit subscribe if you haven't already. We have lots of great women's health content with exercises and other topics just like this, because I want women to know there is help out there and guidance. So thank you so much for watching.